Today is April 28th, 2021. Welcome, everyone. I am Trey Dobson, Chief Medical Officer at Southwestern Vermont Medical Center and an emergency medicine physician with Dartmouth-Hitchcock Health. And this is Medical Matters Weekly, a show about the aspects of healthcare that matter to you most. My guest today is Tom Haley, Director of the Turning Point Club in Bennington. A little bit about Tom before I welcome him. He is a Bennington native. He first worked at Turning Point as a volunteer, eventually became a member of the board of directors, including the board president. He's a certified recovery coach and part of the Peer Recovery Emergency Department program with Southwestern Vermont Medical Center as a partner. And he is the director of Turning Point. Welcome to the show today, Tom.
Thank you, Trey. Good to be with you. Thank you.
Well, we're so excited to have you, and Turning Point is such an influential part of our community, so necessary, and it's good to get this message out. You know, we're going to have people in the audience that are very aware of Turning Point, and they're tuning in to hear you talk and to hear more about the program, but we're also going to have others that have still no idea what Turning Point is, and they're waiting to hear what we have to say today. So I'm excited. Before we go into your work, it's always good to, I love to talk to my guests a little bit about their past history a little bit. And you grew up in Bennington. What was Bennington like, you know, about 50 years ago?
Well, about 50 years ago, I would have, go back a little farther. I was born in 1950, and Bennington was just a small, nice, quiet little town to grow up in. Maybe it was something like Mayberry down south, you know, or at least that's how it seemed to me. Little League, cookouts, you know, digging tunnels and snowbanks in the winter, and just it was a nice little town to begin life.
That's great. I know that whenever I see old pictures, like I believe up at Madison's, there's some pictures of Bennington and other places in town, and it's just great to see. Mayberry does come to mind, so that's fantastic. So let's introduce us to the Turning Point Club. Tell us a little bit, maybe what the mission is and how it unfolded into what it is today.
Sure. The Turning Point Club is one of 12 turning points in the state, and they are referred to as recovery centers. And in the past, when I first started coming to the Turning Point here in Bennington, the people that came here were in some stage of their recovery. And most of what happened here was that people with maybe a little too much time on their hands during the course of their day could come here and hang out, be together, talk together, had hosted a lot of 12-step meetings, mostly AA, Alcoholics Anonymous, and some NA meetings. And that was really about what we did. And it was good. Now, it has changed dramatically since I first started coming here. Certainly, we still host meetings. Right now, they're on Zoom. This COVID pandemic has affected us in the same way it's affected every institution. But we do a lot more with people now. Many of the people that come here are in their very early stages of recovery, or maybe they're seeking to enter recovery. We do a lot of recovery coaching. We have people who are trained to be coaches, and essentially what a coach does is meet with people and just take a look at where they are in their life and what do you want to work on first, you know, and try to zero in, because when you first get into recovery, it can be overwhelming. Everything's a mess. Well, let's start to untangle the mess a little bit. That's all. We'll do it together. You identify what's most important to you, and we'll work on it. Maybe it's employment. So, you know, we can help people enter into the employment world. Maybe it's healthcare. We can help people enter the healthcare world because they don't know what to do. So regardless of what it was, and usually it's not just one aspect of their lives. There's a few. Housing is a big one. But we'll help them get on the journey, and we'll keep meeting with them over and over again on a weekly basis to make sure that progress is being made. And that's essentially what a coach does. A coach knows what the resources within the community are and can direct the person to those resources and help them navigate through that, thereby slowly improving their life. The other change that has taken place since I've been here, Trey, and you referred to it, is the recovery coach in the emergency department. And whether you like it or not, right now, I've got to sing your praises because I'm just not sure that the people in this community are aware of what a treasure the Southwestern Vermont facility is, the healthcare facility. When we first introduced the recovery coach in the emergency department program, you people embraced it. And the way it works essentially is that if somebody comes into the emergency department and it is determined by the staff there that at least part of the reason they ended up in the ED that day or that night was had something to do with substance use, then the people on duty call a recovery coach who is on call, and that person goes up and meets with the patient. And it's a remarkably effective program. That program, and I hope your staff know it, has saved lives. Because we have to keep track of the data to report it to the state. And so I can tell you for a fact that it has saved people's lives and changed their lives for the better. That program exists throughout the state of Vermont at other facilities. Not all of them work as well. Part of the reason it worked so well here, especially during COVID, is that we never stopped going. And that's not because of anything we did. It's because of what you people did to make it safe for everybody to keep going to the ED despite the COVID situation. Other turning points went virtual. They tried to do this virtually, and it just doesn't work as well. There's no substitute for personal contact, peer-to-peer, which is what we are. Peer-to-peer contact, people identifying with one another and going forward. So that's the other big change, that the coaching program and the ED program are the big changes that have taken place since I first started coming here to Turning Point. And again, I've got to thank you and your staff people. People ask me throughout the state, how did you get into the ED? Because in other areas of the state, the ED department was reluctant to call them. And so I gave them my secret. I made a cheesecake and I brought it up and I gave it to the staff people. And we're all human beings. Yeah.
Well, that's great. You know, for the audience, Tom, you hit on just so many key points there, and I just want to emphasize these so that the community that is not as aware of Turning Point and the programs you mentioned understand why it is so important to support Turning Point and similar programs in our community. And one of the main reasons is like you said, you know, initially Turning Point had a more focused mission, and that's how a lot of recovery, not programs, but resources exist. They have one specific thing they do very well, but unfortunately, someone who's going through this process that needs to get back into society, that needs to be a contributing member and also have a life and find joy, they need that full coaching experience. You know, they don't need someone to give them handouts. What they need is someone to hold their hand and get them to the places and navigate the difficulties. Like you said, healthcare being incredibly complicated, navigating through that, employment, and other aspects. And Turning Point is incredibly successful. Sometimes it takes people multiple attempts, but Turning Point's always there for them. And I will tell you, yes, as an emergency physician, I've been practicing here for about 15 years. I've seen a big change when the Turning Point came in. So I appreciate your kudos to our emergency department and our hospital, but I'm going to turn it back and say thank you to all you and all of your colleagues do. And we'll move forward here and learn a little bit more, especially again for the audience that's intrigued and doesn't know as much. Tell me a little bit, just really from your perspective and what you've learned, sort of the history of substance abuse nationally and locally. And you can take that statement any way you want. You might just start by saying, what are some of the cases you see here in Bennington?
Certainly, I think that the opiate use has become much more visible. I believe that it was there. Alcoholism is still, it's almost like alcoholism is a problem we used to have. That's just not the case. Alcoholism is still a big problem for our society. But the opioid use, I think, has increased and it's become more visible. And it's in a social way, it's not an accepted form of substance use. People are used to alcohol being around. You can go into a bar, get a drink. You can have a drink with dinner. You can't do that with opiates. So I think it's a little more foreign and a lot scarier for people in the community to have to honestly tell themselves, we've got this in our town. But it's not a hopeless case. It's nothing to be afraid of. It's something to acknowledge, and we've got to commit resources to it. And if we do, and if we work together, and if we don't judge people, but we try to help one another, then we will make progress. No one that I have ever met said, someday when I grow up, I want to be addicted to a substance that controls me. So there's an old adage that I'm not a bad person trying to get good. I'm a sick person trying to get well. And if we think of substance use disorder that way, I think that we can approach together as a community. We can approach it in a healthy way, and we can do something about it. We can help one another. That's the thing about Turning Point. One of the key elements is that we're a peer-to-peer organization. The people that coach other people have been where those people are now in their life. They have found a way out of their addiction, but they have been there before, and they know what that life is like. And when they want to help somebody, they want to do it compassionately because they can identify with that person. They have lived that life, and that makes a big difference.
You mentioned, Tom, opioids, and like you said, when you were growing up in Bennington, that wasn't a recognized problem. And when you joined Turning Point, it was seen, but it's also just unfortunately expanded tremendously, especially with the more powerful opioids. And most people are very aware of this because it has gotten solid media coverage. There's been a shift. The source of the opioids has changed from a lot of prescription drugs to now illegal shipments, and the numbers keep going up. We plug the dike, we limit the number of prescriptions, and then the drug comes in from somewhere else, and it's more powerful. And then there's the stigma attached to it. Can you talk a little bit about what you've seen from your vantage point in regards to stigma, whether it's improved or actually grown worse over the last several years?
Well, it's kind of a mix. certainly there's a different stigma attached to the opioid situation than there is to alcoholism. People just don't seem to be as afraid of the whole notion of alcoholism. They probably have experienced it in their life, and it's in their family. But this new one is something that you might have seen about in a movie, but you never had it in your life. And but here it is. The but at the same time, I think it's getting better. For example, we're working now with the police department and the EMTs, so that when they're called out to an address, somebody's home, whatever it is, and it's determined that part of the reason they got called was substance use, that they call us the same way we're called to the emergency department. We are now getting called by the police and by EMTs to go to the scene of where they are, because we want to be able to get involved as quickly as we can. And we urge people to go to the emergency department. This is another grant, actually, that your facility got, the hospital got, and we're part of that. And one of the byproducts of those sorts of efforts is that all of the institutions within the community, whether it be the hospital, whether it be the police, whether it be the EMTs, whether it be the Turning Point, it can extend to the DA's office, it can extend to probation and parole. We all begin to work together with the same sort of attitude, so that regardless of how people enter the system, as we call it, they can encounter all of the elements of the system. It's not just getting arrested, for example. It can also be getting help. It can also be, the charges are changed. Your life doesn't have to be forever ruined. You can, because people are recognizing that we can't litigate and arrest ourselves out of this. It has to be a multifaceted effort. Everybody bringing their talents and what they have to the table. Nobody's better than anyone else. And that let's determine what this individual needs, what will give them their best chance. And then let's apply that and do the best that we can. And it's working. Oftentimes we see the failures because they'll make the headline. What we don't see every day is the small successes that people are making in their life. But they are there, and I believe that we have to just keep at it, remain optimistic, and work away. I've met some wonderful people working in this endeavor, whether it be yourself, Trey. You're a friend of mine, and other people up at your place, the people here, my colleagues, Ralph and Julia. These are wonderful, dedicated people who, people at UCS, people up at Savita. They're everywhere. We just don't know it yet.
That's right. And, as far as the stigma goes, I do see it improving. It's slow, but I think people are recognizing exactly what you're saying, focusing on all aspects. Yes, prevention. Yes, using the drug take-backs. Yes, working on prescribing much less from doctor's office. Yes, working on trying to catch the drugs before they come into the country. But also the intervention right in the moment with the use of Narcan and making that available. In regards to other substances, making acute treatment. And then the aftercare, the most important part probably, and that's where Turning Point shines, in recognizing those individuals and coaching them through, really the rest of their lives, but certainly the next several years until they can, do this on their own. And for those out there that still are curious but don't have that much information, there's a lot of resources, including the Turning Point itself, but other resources online. And you'll start to notice that there are many people out there in the community that you know personally who are happy, living joyful lives, successful by many measures, who have been through recovery themselves. And I think once people start knowing friends and family, or even going through the process themselves, that stigma improves in the country, and that's very important, because with, I would say 30 years ago, you couldn't even get hired if someone found out you'd been through recovery, and now employers recognize that that's some of their best employees because they've been through a process that helps them be disciplined and focused, and they have a mission. So those are all the positives. What do you see are some, as we're sort of wrapping up here, what do you see as some of the greatest challenges, specifically locally, and maybe some thoughts on how we could address those?
Resources. One of the most difficult situations for a person to be in especially in early recovery. I mean, let's say they went to a 30, 60, 90-day program, whatever it is. They get out, they go back home, and they have no place to go. They have to go back to the same place they came from. So they're in the same environment, and they're with the same people, and they're exposed to the same temptations. Mm-hmm. And it's extraordinarily difficult for them. Right now, Ralph here at the Turning Point is going through the process, and it can, hopefully it won't fall apart. It could, but he's going through the process because he's dedicated to develop some recovery housing here in Bennington. Let's get some beds so that when a person gets out, they have a place to go, not to just live for nothing. I mean, you have to seek employment, you have to take care of yourself, you have to do your part, but there's a safe place for you to go. We don't have nearly enough of that in Bennington or in the state of Vermont. There's very little, if any, recovery housing around. There are very few facilities to get into to start your recovery. We just don't have enough beds. Beds translate into resources, it's funding. But oddly enough, as a result of COVID, some more money has become available to communities, and so Ralph's pursuing those. And so I would say, in terms of what are one of the biggest challenges, housing, beds, giving people a place, a safe place to be until they can continue their transition into life safely.
Well, yeah, and Ralph has talked to me several times about the need for acute beds when someone is going through the symptoms of withdrawal and needing that safe place, all the way up into finding work and having a place they can go back to, as you said, that is safe, and they're not going to be surrounded with what brought them in the first place. So just a couple more as we close here. If I'm a community member, I'm listening to this, I find it endearing, I want to contribute in some way, whether that is through donation or time. How should they do that? Should they contact you directly, contact Turning Point? What would you recommend?
What I would recommend for most folks, because most folks I think have access to a computer, the internet, go to tpcbennington.org. There's a place to contribute, but certainly we are here right now. We are here physically from 11 until 4. We're going to revisit that, but we never closed up. The other Turning Points, and frankly, some of my counterparts throughout the state said I was doing this wrong, but we never closed these doors. We're always open, but we remain safe. The same way we are always working with you folks together, not virtually. I just felt that was important. If people want to stop here, I want them to stop here. Just ring the doorbell and somebody will let you in and we can talk. And certainly we need contributions. Absolutely we do. But just as importantly, we need people. Maybe more importantly, we need people, whether they be volunteers, whether they be a family member or someone who is struggling with substance use. Come in. And I mean, Julia is a wealth of knowledge and compassion, and I don't want to increase your workload, but if you've got that situation going on in your life, come in. We'll work with you. We'll help. There's help. There's hope. There's a way.
Well, Tom, thank you so much. And again, please tell everyone how important their work is. We so much appreciate it. When I say we, I mean everyone, the community, certainly from my vantage point, the emergency department, all the patients we see. So thank you. And thank you, everyone, for joining us here on Medical Matters Weekly. This was Tom Haley of Turning Point Club in Bennington. I'd like to also thank Mike Cutler from CAT TV, Ray Smith from Southwestern Vermont Healthcare, and Ashley Jowlett from Southwestern Vermont Healthcare. Next week, we have two nurses, Patty Johnson and Caitlin Tilley, who will discuss getting vaccine out to the BIPOC community and other aspects of COVID for those that need additional resources or actually are just lost and can't figure out what the next steps are. Please send your questions in early to wellness@sbhealthcare.org. And I'm Trey Dobson. Go out and find joy in what you do, even in the face of adversity, and we'll see you next week.